I want to introduce Peter Bergmanis, who is the founder and the longest-serving co-chair of the London Health Coalition. The London Health Coalition is a chapter of the Ontario Health Coalition, which is a nonpartisan public healthcare advocacy organization, now with 725 members across the province, and I'm sure it is growing in light of what we are hearing from the Ford government recently. Peter has strong ties to the community and to organized labor, having served with the United Way and Neighbourhood Legal Services, and as a former Vice President of Healthcare at Unifor Local 27. Peter brings over 30 years of experience in the London healthcare system to his role as the primary spokesperson for the London Health Coalition. So thank you for being here tonight. I also want to welcome Dr. Jody Hall at the end here, who is, she has a PhD in Health and Rehabilitation Sciences and is a full-time professor at Fanshawe College in the School of Nursing. She also teaches in the collaborative Western Fanshawe BSCN program and in doula studies. Jody has been a full spectrum doula since 1996 and co-founded the London Doula Project in 2016, a grassroots organization providing accompaniment for all reproductive outcomes, particularly abortion support. So thank you very much for being here, Jody. And finally, Dr. Abe Outshorn, to my left here, is an associate professor and associate director in the School of Nursing at Western University. He holds the Arthur Labatt Family Chair in Nursing Leadership in Health Equity and is the managing editor of the International Journal on Homelessness. So please join me in welcoming my three panelists. Okay, so I have some prepared questions, and I wanted to start with the first film. Really focused on the exodus of doctors leaving the province of Saskatchewan. I think that what we are seeing in Ontario for some time, but particularly throughout this pandemic, is a nursing shortage. We are seeing nurses burnt out and exhausted and feeling more stressed than they ever had before in their profession, and are just switching careers altogether, or retiring early, or going to other jurisdictions where they get compensated more appropriately. Because of course in Ontario we have Bill 124, legislation that was introduced prior to the pandemic that caps public sector wages at 1%, and that has really just been a very troubling symbol to nurses and healthcare workers of what the government thinks of the sacrifices they have made and the work that they perform in the public sector. But I wondered if I could hear from all three of you about the impact of privatized healthcare, public sector healthcare on healthcare workers. And do you see any parallels from what we saw in the film to what is currently happening in Ontario? So I'll start with you, Peter.
Thank you there, Peggy, and welcome to everyone coming out tonight. I'll make a correction. The London Health Coalition is one of 50 chapters of the broader Ontario Health Coalition, and that is 725,000 strong. So, and as Peggy points out, growing, because as you saw in the films, the first film pointing out the gong show that is our government with Dougie Ford is only increasing the attention of the electorate as to what they need to do to reverse what's happening. And every day you'll have a doom scroll And I know that's gonna frighten a lot of people into maybe just submission, but it's actually getting a lot of people hostile. And I see that you're here. That means that you're actually getting angry about what's happening in your society. So I'm a former healthcare worker myself. I decided to retire early, right at the beginning of the pandemic. I saw what was happening to my colleagues. They were trying at the best of their abilities to cope in a system that was already underfunded for almost 15 years and with no absolute end in sight. Many of them don't have that option I was able to take. I'm out. But I'm hearing still to this day, every day, about how they're expected to do more with less. They are not getting the resources or the extra staffing levels that are promised. The government is sitting on a mountain of cash that should have been utilized during the pandemic, which is still ongoing. Never stopped, and now we have other infectious diseases circulating in the community. And none of that has been released. The latest economic statement, and Peggy knows it very well, doesn't have an ounce or a penny more of money to support our public healthcare systems. Doug Ford, prior to the election, promised he wasn't going to privatize anything. You saw the same pattern in the two movies. No, we're not going to privatize. And yet, here we are, finding out that, well, there is a bit of money, like $25 million worth, set aside for independent health facilities and private facilities that charge profit. And they're going to somehow help us with our long wait lists, which they can't. And meanwhile, those healthcare workers are going to be split between, do I continue on this horrible lifestyle where I can't get time off, I can't see my own family, I might jeopardize the health of myself and my own loved ones, or can I go into a private agency, which we have a plethora of, unfortunately, and get paid double what I'm getting for my contract work that I'm doing here in my own hospital, at a better lifestyle, pick and choose my own hours. I can't blame anyone to do that. I can't blame anyone that is in the system for retiring early if they absolutely can. I certainly did it. But by golly, we better be standing up for them and saying, listen, we're going to do everything in our power to absolutely defend your ability to do what is an essential duty in our society and not treat you like you're disposable. People are breaking down, the mental health is diminishing. We don't have anything in the community to help these people, or much less anyone else. And this is the tip of the iceberg, and I know that people like yourselves here tonight are going to rally and stand up and do action. It won't be just hope. Hope, as Chris Hedges says, does reside in action. And tonight's just a part of what that action is going to look like. But I think I better hand it back to Peggy.
Abe, I wondered if you wanted to talk about the experience of healthcare workers in both privatized and public systems.
Great, well, thanks Peggy, and thanks everyone for being here this evening and caring about this issue, because I can tell you absolutely as a professor of nursing that nurses do feel kind of left out alone. They feel like people aren't hearing and aren't caring about them. And I can tell you exactly where that happened, and the tipping point on that was actually, it has to do with leadership. So, you know, however we feel about Doug Ford's stances on things, during the period of the pandemic where he was speaking every day about the pandemic, and he was expressing concerns of people, he was expressing concerns of our healthcare system, nurses continue to kind of push on and struggle on. As soon as our leaders, Doug Ford and others, collectively went silent and decided that the politically savvy thing to do in a pandemic was to say nothing and do nothing, that's when nurses began to feel abandoned. Abandoned first by the leadership and feeling unheard. And I can tell you how I know that is, as an instructor, I've been at Western now for 13 years teaching. And so I have 13 years of students who are out there in the field, and they know where to find me on Facebook often, or on Twitter. And I saw this in the pandemic as each incoming wave would start. I would know it was coming before it hit the news because I would get the messages from my students, to start to get the messages of panic, of concern, of fear. And now I get that constantly. It's not to do with pandemic waves anymore, it's to do with the crisis in the healthcare system. And they reach out to me, and I'm glad they feel they can reach out to me, but I'm also worried. I'm worried that people in the public sector don't feel safe to say the things to me that they say to me, to say those publicly. They fear, they know that our public healthcare system is more politicized than ever. They know that if they are speaking out and they're identified with their employer, they know that these days you only get funded in healthcare if Doug Ford likes you. And you see this when the government makes announcements. You have 4 or 5 clapping seals of hospital CEOs who come out supporting Bill 124 or supporting Bill X, Y, or Z. That's not an accident. That never used to happen. You never used to have hospital CEOs lining up to promote legislation. But we know now that money goes where Doug Ford favors, and that's a big, big problem. In terms of privatization, in terms of what this actually looks like, I wanted to mention that it's not just about nurses leaving the system, but it's also disruption in the system. And so what happens when we have a cost of living crisis and a wage cap is the only way you as a nurse right now can have a hope of a wage that keeps up with inflation is to look for a new job. Because you can't get a wage increase where you are, you have a hope of looking somewhere else. So even nurses who are staying in the system, we've caused this mass disruption because they're moving. They're moving to another job, another position, trying to find an increase here, trying to be able to support their family by going and working there. And so even nurses staying in the sector are moving around. And so you can go to a dialysis unit where every nurse on that unit is new to the unit. And that's not good for our healthcare system either. And so then in terms of nurses leaving, this is where I think the most kind of insidious action on privatization is occurring as we speak. We saw it in long-term care for years and years, and we saw what that meant during the pandemic with private long-term care having worse outcomes than public long-term care services. It's in that shift to agency nursing. And that's where it's happening in real time, where we can look to the US to see how this unfolds decades before us and how it's unfolding now. So what happens, and this is so very intentional, and so I always felt like, am I a conspiracy theorist when I say that they're doing this on purpose? And I always used to hope maybe that's just a cynical part of me. Maybe it's not true, but it's happening now, and that's when there's understaffing in a broken system. When nurses are underpaid, when nurses are motivated to retire, to move to other jurisdictions, someone has to work the unit. So where is the only place where hospitals have to turn to? And they don't do this willingly. Hospitals are independent organizations. They're not told by the government where they have to get their staff from. But the only staff they can get these days are agency nurses. These are private organizations, quite literally run by friends of the Conservative government. That's intentional. So it's an intentional hollowing out of nurses from the public system so that hospitals have to turn to private agency nurses to fill the gaps. That is not just bad for our system, but it's also bad for the finances of the hospital. So these are the same hospitals that have been required to do zero-based budgeting, which is you cannot increase your costs, even though the costs of things like turning the electricity on your hospital go up. They can't increase their costs, but agency nurses cost way more. So we're not getting cheaper healthcare by going privatized. We're just shifting public funds from the public system to these private agencies supplying the nurses. So we're getting worse care, and it's costing more, and I'll stop there and turn it back to you, Peggy, before I start to sweat, because I'm getting anxious.
Jody wants to comment. So I'm going to start from a bit of a different place. This is not my substantive area of expertise, is to understand the nuances of how our government does what it does. But where I'm most firmly rooted is in communities where they're already underserviced, people who are criminalized, people who are deprived of housing, people who are seeking gender-affirming health care, people who want, as Peggy mentioned in the introduction, people who need accompaniment to abortion services that are very difficult to secure, even when we have the ability to do so in terms of the framework to provide safe, accessible care. It's often very difficult. And I'm also really concerned about what happens to people at end of life. So I spend time with families and communities looking for ways to secure safe and dignified ways to take care of their families in community who are often palliative, and trying to fill in the gaps. And so I will back that up just a little bit to say, I have a tattoo on my arm that is the handwriting from my mother. She was a registered nurse for 45 years. I grew up listening to her stories of nursing being a calling. It was a way of being. It was not a career for her. And the tattoo says, "I love you, keep safe, be well, I love you, Mom." And it was a handwritten note that she sent when she mailed us our first package of homemade masks. And that was March 2020, long before, at that time there was still the debate and it was circulating whether or not masks were a good idea. And intuitively, from all her years of nursing, she absolutely knew that this was at least a way of reducing harm. It just made sense. And so she was making batches and batches by the hundreds of masks from her fabric collection, from making quilts for people to come pick up in her mailbox to try and support the community efforts to be safe. And I think about how it was very emotional to listen to the healthcare providers in the video, because I saw the faces of the people that I care about and the way that they have been undermined, the vitriol, how quickly they went from hero to being this scapegoats. My brother is a healthcare, he's a nurse within our community, actually a classmate of Abe's when they graduated, and I see the toll, I see the trauma that exists within our healthcare force in a way. Again, I've taught for over a decade in the School of Nursing. I have never witnessed what I am witnessing from my students when they return from practice, from my colleagues who are reporting back. It is a level of systemic violence perpetuated against healthcare workers way beyond whether or not they're overworked and adequately paid. That is one thing I think most people within helping professions view part of their work as being in service of. It is the way that they have become treated and the way the rhetoric of leadership has shifted from appreciating and honoring the sacrifices and recognizing that people within the healthcare system gave up disproportionate amount in order to meet the needs of the public during time of crisis. To go from that to seeing what we're seeing now, that's the insult to the injury, that's the burnout, that's the long-term consequences of this pandemic that is ongoing. At first, it was the lengths that they had to go to secure adequate PPE and feeling like they were not even remotely protected and feeling gaslit that it wasn't necessary, to navigating through to where we are today, which is very real public backlash against the continued advocacy that is coming out of the wisdom of those at the front line. So that is my big concern. My other issue is that I think that the actions from our government is a very visible display of systemic violence against a gendered profession. And so for women and gender nonconforming folks, this is landing in a very different way. They are often caregiving as part of their professional role, and then double duty caregiving when they're off shift, so caring for raising families, caring for aging adults. So when I hear this language of the private sector coming in and being able to fill the gaps, for me what that really means is it's more unpaid exploited workers, often women and gender nonconforming folks, that will be filling in the gaps. Because having been a doula, I know that the clients who can pay me to provide care, I can be there for the course of the duration of their pregnancy. But for those who cannot afford access to care, who's filling in are people that feel compelled from a social justice perspective to ensure that no one gets left behind. For those of us who would say it is inequitable, it is unjust for somebody to go without the type of support that they need, that has a clinically demonstrable better outcome if that person is with them, we'll just volunteer. We'll just show up. We won't ask for anything. We'll slide our scale. And so that's what's going to continue to happen is, yes, we have this move towards privatization that will pull people out of the system, but the system will also rely upon just more unpaid, uncompensated caregiving from those that are already doing it. So it's exploitation across the board as it erodes the public healthcare system.
That's actually a perfect segue into the next issue I wanted to raise, which is around health equity. And we saw that in the second film where they talked about the STC, the public transportation service, and what the loss of that meant for people with disabilities. And certainly in the pandemic, we have seen racialized and lower income people have been disproportionately hard hit by the pandemic, and there's data showing the higher rates of infection and death among those populations. So I'm just interested in your perspectives on what privatized healthcare will mean for health equity versus, trying to expand and improve our public system. And I'm going to start with Abe this time.
Yeah, I really don't think it's much of a mystery. I mean, when governments try to argue these, they try to go with, as if there's some kind of unknown. Well, we need to try something new and try something different, but we already know long-term care already exists essentially as a two-tier system, and we can already see what that looks like. So it's not any mystery what's going to happen if we evolve that model into more parts of our system. Are there folks in this room that are concerned about long-term care? Are you concerned? Yeah, are you concerned for family, for yourselves, for the future? What that looks like? Absolutely, it's terrifying. It's terrifying to know that what you have to pay is going to determine the quality of your life in your later years. And it's even more terrifying to think that we would evolve that to the entire system. So, I mean, as an academic, as someone who's taught our health policy course, we look to realities, we look to the evidence, and the evidence says that two-tier systems mean that those who can afford to pay less will die younger. They will live with more years of illness. They will have less income to meet the other needs of in their lives because more will be consumed by health services. There are other examples we can turn to, of course, and our neighbors in the South, our unfortunate neighbors, are always an example of what doesn't work in healthcare. And I think there's nothing more striking to me at this point in time than to think about the fact that the average life expectancy in the US is now almost 10 years less than in Canada. Like, that's shocking to me. It's shocking to me as someone who considers myself middle-aged now because I anticipate a life to 80, 82, 83, to think that if I was in the US, I'd be anticipating a life to 72 or 73. And to think of retirement as being so short. That is the effect of a two-tier healthcare system, is the vast majority cannot afford quality healthcare. And so I think it's really terrifying that we consider that. And the video did such a good job. Of course, like, what can we add to Tommy Douglas? And then there was also another piece in there that I hope everyone heard, because this is where they're sneaking in two-tier right now in Ontario, is private clinics, surgical services. You'll see it, you'll hear it, and you may even have to access it the next time you go for a knee surgery or surgery with your ear or your eyes or something else. That may happen at a private clinic, because those are coming in as we speak. We need to stop that. We need to stand up against that. We need to say that that cannot be the direction for our system, because absolutely that will disproportionately affect those with less resources in our community.
So that, I'll just quote Abe. We turned to each other after the second film. We were like, okay, well, just all of that, right? There's so many issues. And so one of the things perhaps that I would like to enter into a conversation around is, I think for many of us that have been doing this work, we're looking at ways to expand access within the public system, not look at ways of off-putting it. And so it's alarming to consider that this is a conversation that's happening around privatization, when we're looking at what it was, imagining the possibilities where our public healthcare system would be a place of refuge for all people, no matter where you enter, and that how can we fold in vision services and dental care and access to medication. We have both personally, perhaps many of us in this room, I have supported people deprived of housing because of not being able to afford their medication or having to make the choice between making their rent next month and their medication. And those are impossible decisions that people make. And we're so much more comfortable with criminalizing poverty than responding to people in a public system for their healthcare needs. As somebody, I live with a disability, I often rely on not only the publicly available healthcare system, but in my extended health benefits that are attached to my workplace. I would be in a lot of trouble, my family would be in a lot of trouble if I had to personally pay out of pocket for the amount of services that are required. So physiotherapy, a nutritionist, all sorts of access, the medication that gets covered to treat my condition. That would not be affordable unless I had workplace benefits that were attached. Those benefits in a proactive healthcare system would help us take care of so many people that we are seeing who are deprived of housing within our own community, who are faced with impossible decisions about how to secure medicine, how to secure housing, how to secure access to the services they need. And so at a time when we're looking at privatization, I think, oh my goodness, we need to be really looking at how we expand services to pull people in. I needed to go to the emergency room, so really personally 3 weeks ago, to treat a really acute pain flare. My partner pulled up and there was at least 10 ambulances waiting to off-bank or offload. And this was when it was in the news, 20 to 40 hour wait list, depending on how you're triaged. We turned around and went home. And had I not had access to a safety plan and a wraparound support system, I'm not sure I would have made it through that night, because untreated acute pain, there's no place in the system for treatment of that nature right now. And that was not the case years ago. I would be able to access the care that I need. It is dire, it is here, and people are dying. We are in a death dealing situation with our public health care system in this province.
So, Peter, health equity.
I could certainly start off with a little bit of anecdote about another film that was in our consciousness not that long ago, Michael Moore's Sicko. Now, anecdotally, I was working at St. Joe's Illawarra at the time when this film was filmed. Michael Moore's team requested to get a shot to fit a certain profile of patient that across the border in Detroit, the patient was faced with a dilemma of his insurer would not cover the surgery for amputated fingers on a hand. The man there was given a choice of whether he could have one or two put back. Two were not covered, one was. So he had this existential dilemma of, do I have to go into bankruptcy to pay for my extra finger, or do I live with this? The team found here in London, Ontario, the doctor who was basically shocked to find, as we all are, that he actually had to make that decision. And so the gentleman was brought to St. Joe's, had the surgery performed, and certainly was not charged for having to decide between which finger would remain on and which wouldn't. Characteristic of the entire commercialized for-profit system. You cannot serve two masters. You can only either provide decent public care, or you provide profit for your investors. Long-term care in this province, same old story. Once it was actually predominantly non-profit public. A certain party comes into power with a certain nonsense revolution. They closed 18,000 acute care beds. London, Ontario lost 2,000 beds. We had more beds in this city alone a generation ago than we do today. And we're talking about why are there wait times? Well, we actually had more staff, more facilities. St. Joe's was actually a full tertiary, full functioning hospital with the most acute care beds in the city, downgraded to an urgent care clinic now. Ambulatory care, and we still don't even fund that. Defunded for 15 years, people. And why? Where did the money go? We had money apparently 20 years ago. We could certainly afford it then. Why can't we afford it now? Well, we've been shoveling this money into certain funny projects, like maybe the rich don't want to pay their share of what the society is about. And Medicare is about a value system. Accessibility is part of it, and equity is part of it. So Doug Ford came to town in 2018. He goes to a private clinic to talk about how he's going to eliminate hallway medicine. Advanced Medical Group. That's the same facility just down the street from St. Joe's, swinging back to St. Joe's again, downgraded now, and there he has connections with doctors. Same doctors who can't get OR time at St. Joe's. And those doctors are now moonlighting, because there they can make some money on the side and actually get surgeries done. Staff are siphoned off from the public system. We don't reduce our wait times. We haven't done a damn thing to alleviate the problem with all those people in emerge and urgent care. The one urgent care that's public at St. Joe's can't handle the overflow. And of course, we find ourselves in this horrible dilemma. And accessibility, equity, all of that is wrapped up into what we value here in Canadian healthcare. London's a prime example. We're not going to tolerate it.
Okay, thank you. Peter, you just talked about long-term care as an example of a privatized healthcare delivery because of private for-profit corporations that are running the majority of long-term care homes in Ontario. And we see in home care as well, Another aspect of healthcare that has been largely farmed out to private sector contractors, the lowest cost private sector contractors to deliver, which affects quality of care that patients receive. But I wondered if each of you, are there other examples, like Abe mentioned these clinics, like I guess there's, well, certainly Shouldice, which is overtly private sector clinic, but are there other examples of privatized healthcare that we are seeing more and more in Ontario and that we really have to guard against? And this time I'll start with Jody.
Thank you. So we've just finished, myself and my colleagues at Western University, a large survey looking at family caregiving for folks who are beginning families, so preconception through pregnancy and childbirth and early postpartum under 2, and then looking at caregivers at the end of life, so families who are providing care to people who are in palliative conditions, Alzheimer's and related dementias. What was interesting about the survey is we were very curious about the use of digital technologies to support the role of caregiving. Interesting enough, it took place within the pandemic where we saw huge upsurge of the reliance on digital technologies in order to allow people to provide healthcare services to their loved ones. So the introduction of TELUS into this space, we saw a beautiful example here. Throughout our data, there is so much corporate interest at play and a huge desperation to exchange personal health data in order to get access to information that people need in order to care for their family without a sense of where that data is going and who the end user is and how that data is being used as a commodity. And so of course there's going to be big corporations that are involved in the delivery of healthcare because the system itself is relying on the introduction of digital technologies in order to try and compensate for the gaps of the inefficiencies within the system. And so I teach health informatics to second-year nursing, where we're very critical, thinking very critically from multiple perspectives about the role of technology in both helping new models of care be delivered. So how might one delegating nurse, a registered nurse, be able to support 3 PSWs or 4 PSWs in the home to be able to provide care because there's a shortage of that expertise from the registered nurse, and perhaps that isn't the level of skill that's needed in any given moment. So how might they use communication technologies to be able to support more families with less resources? But at the back end, those questions about who's profiting off this, whose data is this? How is this data being safely secured in populations that are intensely vulnerable? If you look at the beginning of life and at the end of life, those are often situations where the healthcare system is inadequate in order to meet the level of care, and families are so desperate in order to meet those care needs and to get access to the information, and the system is not available to them. So that is the piece that really spoke to me about where we're going towards privatization, and it's all nicely framed under this public-private partnership model, and we're seeing that from external funders that are requiring it of us as academics to demonstrate, particularly for myself within a college setting, to demonstrate the industry partnership model and industry having to come to the table with a certain amount of money to partner us in our research. So it shapes the types of research we can even do if we're not able to demonstrate a market value of our health research that's often equity focused. So it has its tentacles in everything that we're talking about.
Yeah, so I already mentioned agency nursing. I think that's a big area that you'll see an increase in privatization, but I'll just echo Jody's point by sharing a little anecdote and this kind of insidious nature of monetizing all things and how these tentacles of privatization look to kind of creep their way in everywhere. So there's a local popular business school that I won't name, and they have an increasing focus on health administration, health leadership, and health entrepreneurship. And they were running a student entrepreneurship competition, and they invited me as a judge, I think accidentally, because they wanted a healthcare perspective on what the students were proposing. And so I sat and I listened to each student group pitch their idea for their healthcare business, and I gave them each a 0 out of 10. And I said to them afterwards, and had a chance to talk to each group, and I said, you know, what are you trying to achieve here? And none of them were trying to improve the system. They were each trying to monetize the public system, right? They were each creating a business to insert into public health care to extract that public dollars into profit for their proposed corporation, right? And that's how insidious it is. These student groups at a, you know, supposedly fun kind of assignment. And then think of these billion-dollar corporations who are figuring every way, whether it's your healthcare record, whether it's your getting an x-ray, whether it's that you need a COVID test that you can't get anymore unless you pay for it. These sorts of things. It's in everywhere in our system. So on that depressing thought, I'll turn the mic over.
And here's the uplifting moment over here. Oh, good. Okay, here's something uplifting. Okay, so we have Banting House here in London.
Yeah.
That is a shining example of what our values are about. And even Bernie Sanders brought a cavalcade of insulin requiring patients from the States to visit London here to make a point. And you saw it briefly in the film here too about how much it costs for insulin. And there it's astronomical what they're charging. Eli Lilly is a corporate scoundrel. So Banting sold to the world this great wonder for $1 and made no money off of it because it was supposed to be for the benefit of mankind. And yet we find that corporations, again, in tutelage to their value structure that is only about making money, will do anything to gouge people who are sick and needy all the time. We lost a great public institution, Connaught Labs, the same way. A conservative government, again, sold it off at a fraction of what it was worth after all the public dollars invested in finding all kinds of cures that were affordable around the world for all manner of things. And it's just beyond belief that after all these examples here in our own backyard, that we could actually tolerate this mushrooming of the private clinics, independent health facilities that we have going on right now. Everyone's heard of MedPoint, boutique clinic offering, you know, exclusive executive appointments. It's basically a glorified gym membership. And they're providing basically what you would go to get to your GP. Except they'll do it on notice whenever you want them to. But of course, those physicians are no longer available to us now that we have a shortage of some, you know, hundreds of doctors in our own jurisdiction. The government's come out begging for independent or for family clinics to stay open extra hours during this crisis now of our ERs being overflowing and our pediatric ICUs overflowing, when they really should have been supporting the structure for a decade and a half now, rebuilding it in the public realm. I don't know how this is even going to address the fact that we have such a critical shortage of physicians, nurses. Another stopgap measure to help us.
Concerned with and distracted while they do their business of eroding our system. But now we're seeing it in the most vulnerable. We're seeing that image of The child, how old was she? In a makeshift bed with blankets, waiting 40 hours in a children's emergency room. Like, is this the point? Like, is this enough? That we have reached that place where we have to draw a line. I don't think we will be recognizable to Tommy Douglas if he was a ghost haunting us in this room. Like, I can only imagine the urgency within which he would be saying, like, we can't rest on this moment as tired as we are. We are capable of incredible things. And I absolutely believe this is by design, that we have found ourselves in this place, because as Abe said, you would have to believe that this is intentional, because it just is so, like, what an opportunity to seize upon, that we are now seeing children in these desperately vulnerable situations. What parent wouldn't say, look at how much do I have to pay for my kid to get better treatment? How much do I have to pay so my mom doesn't have to be locked in isolation in her long-term care home and at risk of bed sores? Like, where's the gateway that I can walk through in order to secure, and how much do I have to give up? Because I'll do it, I'm desperate for there to be an alleviate in the now, and that's what they're counting on, is that we will each take the power that we have and the resources that some people have and just move away and get the care that we need, and that we're gonna abandon the rest. So we just have to commit that we're not abandoning any one of us, and that collectively it is possible that we can move forward. That's good.
Yes, nicely put to my two colleagues there. The grand experiment and the new initiative took place 60 years ago. It's called Medicare. That is the ongoing experiment we're still living with today, the unfinished business. And as my two colleagues pointed out, it was about collectively working together. And I don't believe any of us here think that collectively we're going to abandon these projects. We are capable of incredible things in Canada, and if Medicare was the great gift, the ongoing experiment, then we're going to finish it, and we're going to do it properly with pharmacare, with dental care, do it the way it was intended to, no more compromising with a side that just wants to demolish and take us back 100 years to an American society style. Because that really isn't where we're from, and that's not what we want to be. And all I can say is that I know that the Health Coalition, one of Tommy Douglas's great inventions, is standing on guard for Medicare and is constantly looking for an engaged citizenry such as yourselves. That's why we partner with any political affiliation that represents the same values that the Romano Commission pointed out, is that we want people to care for one another without concern for whether they can afford to pay or not, based all on need. And that is why we're here together tonight, probably to decide if we can do something as an engaged citizenry. We were shocked at the outset of that election where 18% determined the future for a province. And because we probably were very alerted to the fact that the constant drumming of the mainstream media is completely corporately captured, telling us, oh no, it's a shoe-in, no issues here, nothing to see, no deaths everywhere around you, nothing to worry about. So 57% actually didn't bother, thought somehow democracy will run on its own. Only works for those who show up, folks. And we're gonna start showing up. The Health Coalition is doing town halls across province from here until Doug Ford backs away from every insanity and anti-democratic process he's ever done. We're allied with any party, good friend right next to me here, that is in support of those very same values, any community groups with the same values. We had a town hall in Chesley where they've closed their emergency department for over 2 months because they can't staff it. Incompetence, yes, but also defunded to the point it's not functional anymore. They had many residents, and this is die-hard Tory country, who are very upset with their MPP right now. And we're going to do that in every community. We have St. Mary's on our doorstep, facing the same scenario, and I encourage you all to get engaged. All of this is for every one of us in our future and our kids' future and so on down the line. We've been too complacent. We thought this was going to hang around for 60 years and more, and it's already being dismantled from under us. But we're going to wake up the rest of the country, and we're not going to let this go down, and we're going to get rid of these neoliberal fascistoids who are trying to tear this apart and give away everything that is our birthright. So I welcome you to join in with the Health Coalition and any other organization that's doing this good fight.
Okay, thank you very much to everyone who has joined us here tonight, and especially to my three panelists, to my staff who helped pull this evening together. I can tell you that the issues that we hear about in the constituency office that just kind of the general public calls about, concerns about healthcare privatization are at the top of the list. We got a lot of calls from people that we had never heard from before when the news came out, that the Ford government was looking at innovating in our healthcare system and introducing more privatization as a way to deal with the crisis. So people are watching, and I think there is a higher level of engagement on this issue than we have seen on many others. So I encourage you, if you didn't sign the petitions when you came in, please sign the petitions. Me and members of the NDP caucus are presenting those petitions every day in the legislature. My colleague, Franz Jelena, the NDP health critic, introduced a private member's bill tonight. It was debated tonight on prohibiting unfair fees in independent health facilities so that people don't end up, their actual procedure is covered, but they have to pay for the bed, and they have to pay for the food, and they have to pay for the extra tests. So this is a private member's bill that would try to put limits on that, and we are committed to, we are the party of Tommy Douglas, we are the party of Medicare, and so this is a fight that we are not going to give up, and we're committed to doing whatever we can to push the government to drop these plans to privatize further and to move instead to improving public health care. I wish I was more optimistic that is going to happen, but at least if we can get them to stop what they're doing, and then we can work on improving when we elect a new government in Ontario. But again, thank you very much for coming. To everyone who responded on Eventbrite, we will send you the links to those two documentaries in case you wanted to share them with others. Again, thank you, and enjoy the rest of your evening.